Thank you everyone for joining us. My name is Lauren Landwerlen. I'm our Executive Director of Corporate Communications for St. Francis Health System. It's been a couple of weeks since we've done an update, so we are going to give you some fresh numbers for the health system. And then our guest speaker today is going to be Dr. Stephanie Meissen, who is one of our urgent care physicians. So Savon, thank you. So here's a quick update. You can see the upward trend in our admissions, with today being at 121 inpatients within the system. And then on the next slide, you can also see the same upward trajectory that we had this time last year. On the next slide, there's two stats that I want to call out here. One is the average age of our COVID patient, which you can see is at 58. And the number that is a little bit more startling is the average age of our COVID-19 inpatient who was on a ventilator. Last week was our lowest number that we saw there at 48 years old. So for the past couple of weeks, we've been sitting around the 48 to 50, low 50s average age for ventilated patients. So that's definitely something that we're keeping an eye on. The other thing to note is that we are seeing increasing positivity rates in our testing. So that means of the number of people that are being tested, there's a higher percentage of those coming back positive than we had previously been seeing. And generally, increase in positivity rates is a reliable predictor of future admission rates for hospitals. Right now, we're seeing about 556 positive tests per week coming out of our testing sites. And just for reference, at the peak of our two previous surges, which would be January and September, we were seeing around 2,000 and 1,500 respectively for those two surges. So keep an eye on our online data dashboard, stfrancis.com/COVID-19. We update that every day, and then we update on a weekly basis with these system-wide averages for average age and average age on a ventilator. And then for our guest speaker today, I had mentioned we have Dr. Stephanie Meissen, who is one of our urgent care physicians at the urgent care location across from St. Francis Hospital at 61st and Yale in the Springer Clinic building. And I would like to turn it over to Dr. Meissen.
Hi, thank you, Lauren. And we're seeing on a very small scale there in our office, a lot of what Lauren's saying. We're seeing numbers are up. We're also seeing volume is up. This is typically a busy time of year for healthcare, emergency departments, urgent cares, primary care offices, certainly exacerbated by these numbers. So COVID and flu are increasing our numbers in an already busy season. So you'll see volumes up as well as cases. I'm getting a lot of questions from patients. They're not sure if they have the flu or COVID or some other respiratory illness. Symptoms are very similar. You're going to see cough, fatigue. We see a lot of people with runny nose or nasal congestion. They're concerned maybe it's COVID, or it could be allergies or a sinus infection. Fever and chills, some body aches. When people ask, how do I know if it's the flu or if it's COVID? It's really testing. It's so difficult to tell just from a description or just from what you're experiencing. If you have any doubt, better to be safe, especially in light of rising numbers. Come in and get tested at your primary care's office or at an urgent care. I think one of the positive aspects we're seeing is that we are having people not kind of try to push their way through what we used to just consider a bad cold. If people are feeling like they're having symptoms, I think we're seeing a lot of community effort to go ahead and get tested to realize this could be something more significant rather than just a cold. So I think that's a very promising trend. When do I get tested? When do I seek care? I think what we're looking for primarily, if you have those symptoms we've outlined, I think you should get checked. If you know you've been exposed to someone who has COVID or may have COVID, definitely wise to be checked. If you've done something that would put you at increased risk, this would be maybe large gatherings. Maybe you were in indoor activity with a lot of other people. Maybe you've had travel. I think those would warrant testing as well. I think another consideration would be if your holiday plans might include being around people who would be at risk, maybe elderly, children who are too young to be immunized, people who are immunocompromised. wise to be tested to be sure that you're not taking something to the family gathering that you didn't intend to. We have lots of options for non-emergent care. So if you need to be tested, you're not sure if you just have a cold, you just don't feel well and need evaluation. Of course, your PCP's office would always be your front line. But we also have the urgent cares. They're open 7 days a week throughout the area. You can also have a lot of virtual options now. If you go to the St. Francis website, you'll see a link for virtual care. From there, you can go to either a virtual visit with your primary care provider, or you can even set up a virtual urgent care visit. If it's after hours, or maybe you're too far to get safely to a clinic, you don't have transportation, something like that. This is a 24-hour option where you could go online and book an appointment, and you'd be able to have this kind of video interaction with an urgent care provider to evaluate. Next, I think has to follow, when is it past evaluation? When is it an emergency? So for our patients who are sick, when you're trying to decide when do you need to go to the emergency room, I think really you're looking at symptoms like shortness of breath. If you find that you are excessively fatigued, maybe you don't feel like you're thinking clearly, some confusion. If you notice any discoloration in your fingertips or maybe around your mouth, all of these would be signs that maybe you're not oxygenating well, and that would be an emergency. Certainly, emergency departments are crowded and people are concerned about going to the ER, but those are emergent situations in which staying at home could be potentially life-threatening. So those are kind of things to keep in mind. Lastly, I don't think we can say enough about it. It's not too late to get immunized. If you haven't started the series yet, if you need that second shot, if it's been more than 6 weeks since you completed your last immunization and you're due for the booster, it's not too late to maybe enter 2022 a little bit more protected. Certainly it's easy to do. You can go to the stfrancis.com/get vaccinated site, or you can also go to vaccines.gov, and you would be able to set up appointments there to be able to receive those vaccines. They are finding, even with the variants that we're seeing, that we're getting a lot of protection from immunization. So let's not overlook that. In closing, the holidays are here. In amongst all of the other blessings and joys of this holiday season, please be safe. And also, should you need us, we are certainly here and we want to provide care for you during this season and always. Thank you, Lauren.
Thank you, Dr. Meissen. We will now open it up for questions, either in the chat or you can raise your hand or just speak if you're not on mute.
I've got some questions. I was just wondering, with Omicron having the Omicron variant having mild symptoms, are you expecting more of a clinic surge if this gets out of hand as opposed to a hospital surge?
Dr. Meissen, I'll let you take that one.
Sure. I think that it's kind of a rolling process. I think it first becomes a clinic surge, and then, as Lauren was saying, as our testing levels go up, it becomes a hospital surge. So I think certainly we're the front line in an urgent care or PCP's office, that sort of thing. But I think all of it ends up rolling into the emergency departments, the hospitals. I think we all have to be prepared for the surge that will come with an associated increase in cases.
And it looks like we have a question in the chat of what has prompted the high volume of visits. I know that Dr. Meissen mentioned that there are more gatherings, people are spending more time inside if the weather's getting colder. Dr. Meissen, is there anything that you would add in your speculation as to why the volume of visits is increasing right now?
I think traditionally this is a busy time of year to begin with because of all of the factors that you're mentioning there. But certainly I think we're more COVID and flu aware. And so I think people are coming in for testing, as we discussed, when they have symptoms, rather than just assuming it's a cold and kind of trying to push on through. So I think all of those are contributing to the increased volume we're seeing at this point.
Thank you.
You're welcome.
This is James King with Channel 8. It's a question for either of you. Late last week, the State Department of Health said that in recent weeks, they've been seeing an uptick in breakthrough cases and pushing people to get the boosters for that added layer of protection. I was wondering if you all have been seeing breakthrough cases come through your hospital system, if you knew of percentages in terms of patients that are coming through now, and I guess why we're seeing that breakthrough now in terms of those cases.
I can give one stat on that. On our data dashboard on our website, right now, 89% of our inpatients are unvaccinated. Beyond that, I would offer that over to our physician.
I think we are seeing breakthrough cases, but we've been seeing breakthrough cases. Certainly each immunization decreases your chances of contracting COVID. So therefore, the first immunization, the second immunization, and then the sequential booster are your best bet for protection. But I think we have to look at the basically the goal of this immunization is being not simply protection against infection, but also decrease in the likelihood of a terrible outcome should you contract COVID. So yes, we are seeing breakthrough cases, but I think the statistic that Lauren provided shows how effective our vaccines have been in keeping people out of the hospital and off of intubation and other support systems.
Thank you.
You're welcome.
And another question, what options are available for folks who may have the flu or upper respiratory system? What can they do to help keep clinic numbers at reasonable numbers? So I think she's asking, when should people get tested if they start to have symptoms, upper respiratory symptoms, and how to differentiate between the flu and COVID? It sounds like your answer was previously, when in doubt, get tested. And I know that our Broken Arrow Elm site has been running for 7 days a week for the past year and a half. Anything beyond that you would want to add?
I think just to reiterate, you had mentioned the drive-through testing there on Elm, which is great. You can also do the e-visits, the virtual visits. All of those are ways to stay out of the clinics, but still be able to get the testing that'll keep you and your family safe.
Hi there, Jeanette here with Tunis, Oklahoma. Sorry, I realized that my question wasn't clear. So I think what I was intending to ask is, for those who may have an upper respiratory sickness, how should they go about treating it that would avoid having them go into a clinic?
Okay. Well, I think for most of these, I would go ahead and use symptomatic treatment. You're going to be treating your symptoms with over-the-counter medications that would be safe based on your health history or, those kind of factors. I would assume at this point, just to be safe, if you have upper respiratory type symptoms, I would go ahead and quarantine and make sure that you're not potentially exposing people. If you don't, if you're not able to be tested or choose not to be, I would go ahead and quarantine to be safe. And then it's over-the-counter treatment for symptoms. And then monitoring, as we discussed, for things that might become a bigger, more emergent issue.
Also, do you find that the high volume of clinic visits are due to the fact that oftentimes these clinics offer rapid testing, whereas maybe pharmacies offer that option as well, but if they're not readily available at a pharmacy, then let's say that someone who's trying to get back to work is trying to get that rapid test going. Is that another factor contributing?
One thing I want to clarify is that our urgent care centers are not testing centers. Someone that is presenting ill would likely be tested or have a panel of tests ordered by the physician that's seeing them, but that would be through an urgent care visit. For straight testing purposes, that would need to go through our testing site, or as you mentioned, a pharmacy, CVS or Walgreens. And then I know that through our e-visits and virtual visits, beyond the COVID testing that's available at the Broken Arrow site, they are able to order, if indicated, other panels for testing for other respiratory illnesses.
Thank you. Were you going to say something, Dr. Mason?
No, I think that covered it perfectly.
Thank you.
I've got one more question if I can. So with all of the respiratory stuff, the COVID, RSV, the flu coming up, what percentage of care would you say you are giving to other things like grandma's arthritis or something like that? Does I imagine that takes away time from treating those other ailments? How do you make sure those patients are still getting in, or have you had to set aside certain hours to fit those other people in while you're dealing with the pandemic? Thank you.
Dr. Meissen, I'll let you take that one.
Sure. Any percentage I give you is going to be off the top of my head and just anecdotal from personal experience. I would say about 25% of what we're seeing is respiratory. I don't know that that's really that much different than, as far as a percentage, than what we would normally see, because grandma's arthritis, or we're still having, you know, all the usual, I fell off my skateboard, I was putting up lights and fell off the ladder. All of those, and we have chronic and acute situations that we would see normally. I think the numbers in general are because, like I said, it's a busy season, and also the respiratory stuff. We're not having any special hours. Our policy and our urgent cares, I mean, we want to be timely. We want to get to people as quickly as possible, but the door's open, and we see everyone that needs to be seen, as many as we can see for that day. We get up and do it the next day and the following day, 7 days a week. So there are certain hours, and we certainly want people to come in, and we don't want people to be dissuaded for coming in for chronic issues or issues other than COVID or flu. You know, we're not strictly upper respiratory. We're still, the vast majority of our patients are still other situations, but it's a good reminder that those other things still need to come in and need to be seen, and we are certainly capable of doing that.
I have another question. This is Jeanette here again with 2 News Oklahoma. Would you say that the use of masks may also be a factor when the pandemic was in its early stages? Obviously, they were highly encouraged and they were highly used, and that has changed as vaccines have become available, and maybe people don't use them as often. Is that, you know, a probable reason why you guys are seeing more upper respiratory kind of illnesses?
I think that certainly could account for it. I mean, I know that research has shown that the masks were very effective. I know that in our clinics, everyone is masking, but I in the public, I tend to see fewer masks. And this, again, that's just my personal experience, and I'm seeing fewer masks when I go out into public places. So I think there are a lot of factors at play. Certainly, decreased mask wearing in many situations could be contributing to this increase.
Thank you.
You're welcome.
Sorry, I jumped in a little bit late into the meeting, but I did want to ask, why was it important for you guys to kind of put this information out to the public and make the public aware?
We've been putting this information out for the past several months on the website. I think we started early to midsummer and having a daily data dashboard, and particularly during the surges, so that people were aware of what the situation was in Tulsa and Eastern Oklahoma, at least within the St. Francis system. You know, we want to be a source of information and a resource to the community. So it's important information for people to know, and something that we feel is our duty to share.
Thank you.
And then I did have Siobhan pull up our scheduling page for urgent cares. So you can see that there's walk-in visits where you can schedule online. You can also choose your time and schedule your appointment. And you can choose which location you'd like to go to. But if you go back one other slide, back to that main page, the option online care now to start your visit. This is where anyone can start an online 24/7 virtual urgent care visit that they can do from their phone or tablet, any device that has a video connection, so that you can actually see your provider that you're receiving care from. And the great thing about this service is that the providers that are facilitating these online video visits are actually located within one of our facilities, boots on the ground in Tulsa, or in one of our facilities in Eastern Oklahoma. So, if there's an issue that comes up that provider believes should be seen in person, there is a chance that that is also the provider that you would see in person. So we do think it's important for the care that's being delivered locally to be from physicians who are located in this area. Thanks, Siobhan.
And then one last question, how would you define define an urgent care separately from maybe like the ER or, going to the hospital?
Dr. Mason, I'll let you start.
I'm sorry. I think from my perspective, I was formerly an ER physician and then came to urgent care. I would say if you are not in a potentially life-threatening situation, the urgent care is a really great stop. There is so much that can be handled through our urgent cares and avoid having to send people to the emergency department for non-emergent things. So unless you're in a situation with chest pain, shortness of breath, stroke-like symptoms, a significant injury, there's a lot that can be handled through urgent care. And I would really encourage people to utilize those resources so that we can have the emergency department just really handle the worst of the cases that require that level of care. And certainly part of our role as urgent care is to offload those ERs so that they can utilize their resources for the patients who really do have emergent situations.
And then Siobhan, I just sent you the link for our webpage that has some good information about ER versus urgent care, what would be appropriate for either. And it also has the information about what really can't wait and when you should call 911. So if you scroll down, you can see a lot of the points that Dr. Meissen just mentioned. But I think, our general rule is if you're in doubt and you think it's an emergency, 911 or the emergency room is your best option.
Absolutely.
Thank you.
So that being said, how many people on a daily basis go to the emergency room instead of urgent care? How many people do you see that should have gone to urgent care but end up showing up at the ER? I know you don't have a finite number, but I imagine this is a common problem.
It is, and that's one of the reasons that we actually started offering the 24/7 virtual urgent care, because after urgent cares close, a lot of folks are left with only the option of an emergency room. So I know we've seen an increase in utilization of that for patients who know that they don't need an ER, but otherwise wouldn't have had an option to seek care overnight or after hours. In terms of numbers of patients that shouldn't have gone to the ER, I don't have that information. I can look into it and follow up with you after, but that's not something we have readily available right now.
Anything that we didn't ask you that you guys would like to add?
Dr. Meissen, anything?
I can't really think of
Thank you. Were very comprehensive.
No. Thank you. Good questions.
Thank you all.
Well, thank you. And as we have said in all of these other Zoom updates, if you think of other topics that you'd like to hear from us about, either email myself or Siobhan, and we will try to work that into one of our future weekly updates.